Chapter 7, Episode 4, Yellow Flowers at the Window. Then let's start the conference. A pre-operative conference has begun with the Department of Surgery of Claude Choriak, Dean of Medicine, and several students of Thelma de Medici, Dean of General Medicine. Previously, case discussions between physicians and medical students took place in medical schools, but now, for the first time, there will be a collaborative effort beyond graduate school. Thelma had also had the experience of participating in a joint conference with a physician only a few times in his previous life during his postgraduate clinical training and affiliation with a university hospital. Therefore, I interfered only as much as possible, leaving the progress of the conference to Claude's conventional method. This case is an 18-year-old female with a height of 5.3 sticks, a weight of 40 cups, and a thin build. Chief complaints are cognition, memory impairment, increased irritability, past medical history and family history are unknown, and abnormalities in the limbs and trunk. None, no metabolic or psychiatric disorders, mild numbness and gait disturbances. Claude began presenting the case while writing on the board. Claude does not use the units commonly used in the Empire, but the international units established by the Holy Kingdom, so he can understand many doctors and pharmacists. By the way, a staff is a unit of length based on the sacred staff, and a staff is about 30 centimeters long. There is also a grail, whose unit of weight is derived from the weight of the Holy Grail. After Claude explained the basic information, Thelma continued. The mystical examination was done by me with clairvoyance, and I predicted a tumor formation of 0.1 rod or less in the right frontal lobe. The outline of the tumor was relatively clear, and the area could be identified. Blood vessels were running. The localized image of the surrounding blood vessels and the area of blood circulation were transcribed, as shown in this figure. A blood test commissioned from the clinical laboratory department showed no remarkable findings stereotactically identified as a result of biopsy. Microscopically, it was a high-density tumor tissue. Cell nuclei were large and small. Chromatin aggregation was observed. Multinucleated and meganuclei in a necrotic layer were also observed. Genetic examination showed mutations in P53 and CDKN2A. EGFR amplification and MAPK pathway mutations were suggested. Immunohistochemical examination revealed a tumor-specific marker, MIB1. Expression rate of 19%. Clinical course. Neurological findings and pathological findings based on the preoperative diagnosis. It is stage 4 glioblastoma, the most malignant type of glia, and it is believed that immediate surgical treatment is required. As she listened to Thelma's explanation, a lady stood in the front row, quietly wiping away tears. Françoise de Savoy, Natalie Blondel's birth mother and court pharmacist. Ellen also sits at the tail end. There were no dangerous findings in the preoperative examination of perioperative patients. I will explain the craniotomy procedure and how to proceed. Claude once again illustrated the technique and explained further. In addition to the divine magic formulas Claude had developed in cooperation with Nova Root Medical College, the almost standard craniotomy formulas on Earth were adopted based on advice from Thelma. As above, we will perform a craniotomy for intracranial tumorectomy on March 10th in this patient with suspected glioblastoma. Please discuss this case. Brigitte Lenoir gallantly raised her hand there. She is a first-class associate professor of medical surgery at Nova Root Medical College. She is still young, but she is Claude's greatest student. This girl is determined and proud, but her surgery is exceptionally good and she is fat. She wears the white coat introduced this year like a dress. Claude, the head of the medical department, was also the chief medical officer, so he was basically stationed at the palace and broadcast several lectures to Brigitte. He was Claude's representative, so to speak. Continental doctors rank first, second, and third, as do pharmacists. In this world, doctors are all surgeons and perform surgery, even if they have different specialties. Medical school is for surgery only, includes a wide range of clinical departments such as general surgery, orthopedics, and neurosurgery. A first-class doctor is an aristocratic doctor whose patron deity is a god of medicine. It has the divine protection of the god of medicine, and because it is rare, it serves kings and aristocrats in various countries. The number of people is also small. A second-class doctor is an aristocratic doctor with other attributes. Mainly treats injuries, cuts and resections. Worked as a military doctor during the war. Third-class doctors are common doctors who pull teeth, vein and remove boils, and some also work as barbers and belong to the barbershop guild. Incidentally, not a single citizen entered medical school this time due to lack of academic ability. This year, only aristocratic medical students enrolled in the St. Fleuve Imperial School of Medicine. This was in contrast to the medical school. With this in mind, Bridget immediately gave Thelma a chance. Did you say psychic magic? Did you do an invasive brain biopsy just because you predicted psychic magic? That would be no different than conventional fortune-telling. You're right. Thelma replied immediately. I see that you have great confidence in your abilities of the divine arts. Since you rose to the position of chief court apothecary at such a young age, I know that you are a user of the divine arts with unparalleled talent. Be that as it may, complacency is not good for the patient. There is no way to confirm whether there have been errors in diagnosis and treatment so far. Thelma has the diagnostic eye, a cheating ability Claude calls precognitive ability, but whether the result of the diagnostic eye was correct or not, God alone knows the right answer. Based on the disease name, the medication prescribed by the pharmacist, which I thought was appropriate, was effective. His knowledge was based on the best in the world, but he was sometimes out of control. There is just this fact. Then Bridget uttered a sweet voice, hey. He must have been trying to get rid of the young dean who had always disliked him. Something so irresponsible is disgusting. Shut up, Bridget. We're not medical doctors, we're medical wizards. What's wrong with using magic to provide the best medical care? Besides, the results of my biopsy. The tumor was indeed there. Claude's defense kicked in. Claude, who has a medical god as his patron god, applied several divine arts during the operation. In hindsight, that may have been right. Didn't de Medici want to make medical reforms so that simpler doctors and simpler apothecaries could diagnose and treat patients without having to make such diagnoses? Thelma thought her opinion was reasonable, though frank. As you can see. However, this divine art was learned by chance, so it cannot be easily passed on. Then it's just a self-indulgent art. Bridget expressed her displeasure. Thelma's eyes lit up sharply, as if he had expected it. So I think I can show you something close to that. Thelma took out the glasses and a picture at the same time. It was an X-ray tube and an X-ray of the bones of a human hand. This is an emitter for electromagnetic radiation, and this is a photograph of the emitted electromagnetic radiation going through the human body and detecting it. You know what it really is, and I'm sure you know why it looks like that. The photos Thelma handed to attendees in the front row circled the conference room. Bridget went wide-eyed and grabbed the photo from Thelma, while Claude applauded with an exaggerated action, saying, "Amazing." Bridget asked skeptically, "If you improve this, can you diagnose without clairvoyance?" It's just like Lenoir-sensei said earlier. It's meaningless unless it's a technology that everyone can use, so we're preparing a prototype. We will deal with it. Don't do it, child professor. Bridget whistles loudly. I'm not going to give up. Lenoir-kun, you can't be too harsh. Professor de Medicis, I'm sorry, I'll tell you later. Claude acts like Bridget's protector. Other doctors raised their hands. Fluoroscopic photography is groundbreaking, and I have high hopes for technological development, he said. I have no experience with humans. But in the experiments with medium-sized animals have been conducting since last week, 8 out of 10 cases have survived for a week without the use of divine medicine. Claude prepared for craniotomy in a week, even though he had a burned blade. Thelma finds it reliable. Is it okay for me? This time it's a question from Françoise. When it comes to my child's surgery, I'm sure it's a parent's desire to clarify any doubts. A few days ago, Thelma and Claude finally informed Françoise and Natalie about the glioblastoma and obtained their consent for surgery and treatment. Both seemed unable to hide their shock, but agreed that they had no choice but to commit to the treatment. Francoise also plans to participate in the treatment as a member of the medical team. "Thank you so much for organizing such an extensive and challenging surgery for my daughter," she said. Francois bowed on the spot for a few seconds to express his gratitude. "I have 2 questions. I have heard about the existence of these 2 sacred medicines in the pharmacist's drug management during the peri-operative period. I have heard that the medicine decomposes quickly, but how could the temple be stored stably for hundreds of will it interact with existing medicines you are taking? I will answer your question. As for the details of the divine medicine, it is a confidential matter of the Holy Kingdom, so I cannot say it from my own mouth, but I can procure a small amount of something that has no quality problems, but only this time. Regarding the presence or absence of interactions between divine medicines and drugs, we have done preliminary evaluations and confirmed them through literature and divine art analysis. It is a painful statement, but Falma does not lie. The doctors and pharmacists in this place would never dream of making it themselves." Ellen made a worried face and winked at Falma. "Only she knows the truth here. Are you saying that you can't disclose the composition, etc., because it is about the secrets of the Holy Land?" Falma, who showed an opening, was attacked by Bridget. "It is not that it cannot be disclosed, but there is no point in disclosing something that only Falma can do." Falma then said, "The operation can be done without the divine medicine, and the success rate may not change. If you can use the divine medicine, it is better to use it every time, but how is it actually? Of course, the divine medicine resources created by the guardian deities are limited, but..." Falma did not dare to correct the misunderstanding. But since Bridget and the others did not know Falma's current situation, they misunderstood that the divine medicine procured this time was created by a medicine deity in the past. However, Falma took advantage of the misunderstanding. The consumption of this limited divine medicine will quickly be exhausted and the medical technology will not spread. I think it is best to establish it. Certainly. I can't help myself. Doctors and pharmacists agreed. The reality is that you have to. What do I need to do as a pharmacist to support during surgery? A question came from the pharmacy corps. For pharmacists who join the surgical team, we ask for peri-operative pharmaceutical management. This includes management of medications such as anesthetics, temperature control, preparation of medications during surgery, and appropriate use of post-operative analgesics. I will discuss the details at tomorrow's department meeting. It will be a challenging surgery, but let's do our best to save her life. If there are no further questions, we will close this session. In this way, the preoperative joint conference was concluded while the anxiety could not be dispelled. Finally, the morning came. As Natalie wakes up in her hospital room, her gaze is drawn outside through her hospital room window. Behind the curtains, the sun rises over the hazy cityscape of St. Fleuve and the bright colors spread out. "Good morning, Natalie Blondel. The morning sun is beautiful, isn't it, Professor?" Natalie answered Falma as she looked out the window without looking back. Falma stood next to Natalie at the window. "It looks like we'll have nice weather today and tomorrow. Spring is just around the corner. I think I'm going to burn it into my eyes thinking that today is the end of the day." Natalie shared her uneasy feeling with Falma, who brought the oral medicine before the surgery. "If you look at the sun that much, your eyes will burn. I'll see you again tomorrow." "Well, it was before surgery, so you didn't eat." While talking to Natalie, Falma had her drink the divine medicine that Bruno had worked hard to prepare since midnight using a sedative. This divine medicine will give her absolute security for her life today and in the days to come. Asked Falma, who had seen Natalie drink the glass of blue medicine. "Don't you feel sick?" "No. My body feels warm, I feel calmer." Natalie slowly lowered her chest. As for the effectiveness of divine medicine, it seems to have the effect of calming unpleasant feelings. "That's good, stay positive. I have a request for the professor. I can't give it directly because it would make my mother sad. In case it doesn't work, could you please keep this for me? Inside this small box Natalie handed Falma were several letters. Each letter has an address on it and is believed to be a suicide note addressed to his mother, relatives and friends. As I flipped through it, I also saw Falma's name. The ink is bleeding, so I guess it's from the tears. Falma accepted Natalie's feelings with a serious look. Okay, let me keep this for you. I'll also have something I want to give you. Falma decorated the window of the sick room with a small hydroponic bottle of crocuses with yellow flowers. Professor, did you grow ornamental flowers? Well, I'm not a pharmacist in private either. Besides, I heard from your mother that you like flowers. Does this flower have any significance? Yes. Falma smiled, but he didn't say anything specific. Do you have it? None of us know tomorrow, but I don't want you to die today. If you say that much, you can take the bluff seriously. That's the spirit. Next time, we'll meet in the front room of the operating room. Falma cheered Natalie up with that, tapped his fist on his heart, waved his hand lightly, and left the hospital room. Natalie was taken aback when she saw this strange pantomime-like gesture. Is that so? Something went wrong with her, and she emitted a small gasp and gently ran her finger over the crocus leaves. Natalie remembered the floral language of crocuses. Falma said, "Trust me. I hate that kind of man. I really hate him." Why don't you say something important like that? Even as Natalie said this, she smiled for a moment. On March 10, 1148, at 9 a.m., Natalie Blondel underwent surgery at the San Fleuve Imperial College of Medicine Hospital. Since the operating room is glassed in, many medical students come to it with notebooks and cameras. The operating room was also sufficiently lit to keep hands bright by using mirror reflections and light collection. In addition, in terms of operating room hygiene, the sterilization sanctum and Claude's cleaning magic were layered in advance, making it nearly sterile. Natalie Blondel took 2 divine medicines made by Falma, assumed a supine position, and fixed her head with 3 metal fittings. The area to be cut was shaved in place, and the skull was disinfected with povidone iodine, followed by disinfection with alcohol. After marking the resection line of the frontal lobe, general anesthesia was induced by rapid induction of intravenous anesthetic. Since intubation and inhalation anesthesia cannot be performed due to lack of equipment, artificial respiration and inhalation anesthesia are performed by introducing a gas sprayed with inhalation anesthetic into the bag valve mask. The combination and amount of anesthesia are meticulously reviewed by Falma in advance, and management is handled by Falma and a full-time physician in training as an anesthesiologist. To be honest, there are almost no experts in anesthesia management in this world, including Falma. Therefore, I asked Ellen to cooperate, who can use the same eyes as Falma. Falma spent several days training her to capture her pulse, oxygen saturation abnormalities, body temperature, respiratory rate, and any other vital abnormalities. Since brainwaves alone cannot be detected by visual examination, we decided to measure arousal levels by asking subjects to remember the colors and parts that change in response to painful stimuli. If she uses the study eye for a long time, she will be exhausted. Since there are not all the electronic medical devices used on modern Earth here, Ellen is asked to check in before a serious incident occurs that threatens the patient's life. When Blondel's whole body, not just his head, starts to turn red, it's an emergency. The prognosis of the eye exam changes every moment. The judgment that surgery can save lives can be revised if it fails. Even if you use the divine medicine and survive a few days with immortality, if you predict that you will die after that, it is the end of the first volume, so you cannot let your guard down. Therefore, he entrusted Ellen to monitor the vital signs, and Falma devoted himself to assisting the operation by guiding Claude through the tumor and giving specific instructions. You can't handle it if you don't overestimate your own abilities and divide the work. Then an 18-year-old female undergoes an intracranial tumorectomy of the right frontal lobe. After Claude explained, he entered the scalp incision at the marked site. Using Falma's eyesight to predict the outcomes of all the surgeon's operations, Claude's operation was the only one likely to be successful, so he forced Associate Professor Bridget to back off, urging him to have him operate hard at any cost to get him to turn over. Claude has a scalpel with a crystal stone attached to it, which can be transformed into a small magic wand and used as a divine art output device. It seems that the bleeding is controlled by divine arts. The scalpel is applied to the epidermis at a right angle and cut lightly and sharply. The scalp should be well perfused, but surprisingly it does not bleed. Claude had explained in advance that the bleeding would be minimal because the wound was gently covered with a film of divine power to protect it. Do what you say? As expected, Thelma was afraid. Nevertheless, Bridget definitely cut the scalp, placed gauze on the wound edges, and lifted the dura mater. Claude proceeds to lift the incised skin flap in an arc and uses a dura remover to make an incision in the muscle layer that is surprisingly smooth, and then he begins the osteotomy of the skull. The visiting physicians heaved a sigh. As expected from Chief Chamberlain. "Hey, we're just getting started, don't flatter us," Claude replied in a normal tone as the voices of praise grew loud. Even when joking, he never loses his concentration. He took it back to his drill and put something on the bone surface, small hole cube, and cut the gap with a jigsaw. A pre-drilled hole for brain biopsy is also used. By administering saline as needed, Bridget prevents the bone fragments from scattering. "Come on, let's go to the target tumor, please guide me." While Thelma showed a transparent model of Blondel's head, he also paid attention to the location of the blood vessels and navigated to exactly where the tumor was. Claude dissected the brain parenchyma and white matter and approached the tumor along the planned path. "This is..." "Sure, the color is different from the white matter. It's a tumor." The entire circumference of the tumor is removed with a scalpel, leaving a safety margin. Claude proceeded with the incision in the right prefrontal cortex, following Thelma's instructions. The surgery was to be performed while the patient was awake to preserve function as much as possible. Although the bleeding was controlled by Claude's divine art, Bridget pushed the bleeding site out of the stump with clotting and hemostasis. Claude took a deep breath after the surgery was completed. Even when filling up with water, Claude remained calm and did not break a sweat. "Okay, the extraction surgery is finished. I wonder if everything is extracted now. Professor Thelma, please take a look." Thelma took the place of Claude, who had moved his body away, and looked into the depth of the excision cavity, stuck his finger into the excision cavity, and confirmed that no hard tumor remained. "Yes, I think that's right. The removal rate is 99% certain. Then make a quick diagnosis from the removed tumor. This is to look pathologically for tumors in the stump. There are no pathologists yet, but a department has been established that combines the functions of the clinical examination department and the pathology department." While waiting for a quick intraoperative diagnosis, Thelma used a magnifying eye in addition to the examining eye to carefully check for any residual tumor. Even on close inspection, there was no shiny part anywhere to be seen. "I thought the extraction range was sufficient, but just in case, I checked with Ellen. I am grateful to be able to double-check. The goal is a complete cure that can be removed in one surgery without additional resection." "How does Ellen look?" "I don't think anything is left. I don't see any shiny parts, but I haven't even used a microscope to see it. There is a limit to chasing cell unit survival." After 15 minutes of waiting, I was told the private physician's verdict. "It is likely that there is no tumor in the stump. No additional excision is required. Thank you." Thelma replied only that it was fine. To prevent recurrence, a biodegradable carmustine polymer matrix will be placed on radioantibodies directed at the tumor will be administered. "Okay, let's leave this phase to Professor De Medicis. Thelma is in charge of this operation. Carmustine inhibits transcription and replication of tumor DNA and suppresses tumor cell proliferation. Radioimmunoantibodies are the best antibodies against tumors that pharma has found through thorough genetic testing of preoperative biopsy samples. The radioactive material released kills any tumor cell else that may be scattered in the brain. Okay, now let's close the wound, close the head. Claude sutured the dura mater and closed it with Falma's fibrin glue to prevent the cerebrospinal fluid from leaking. Since this was a bloodless operation, it does not seem necessary to place a drain. The bone fragments and bone edges were sutured together and fixed with sutures. Subcutaneous continuous sutures were carefully made from both ends of the skin incision, and the epidermis was also closed with a medical stapler. Done. Thank you for your hard work. Ellen and Falma checked Blondell's general condition with an eye exam. Falma takes over from Claude and moves to post-operative management of anesthesia. Until she wakes up, I can't relax for 20 to 30 minutes. As for infection of the wound, you don't have to worry too much as long as Falma sets up the sanctuary, but watch for signs of infection. The total operation time was 4 hours and 41 minutes, and the bleeding amount was 50. Thank you for your hard work, everyone. Falma said goodbye to Claude as he left the operating room, concluding, and then breathed a sigh of relief. Fortunately, your premonition was correct, Professor de Medicis, Bridget said to Falma either ironically or in praise. After awakening from general anesthesia, Natalie noticed her mother and Falma staring at her with their eyes full. You know me? Well done, the surgery was a success. Françoise held Natalie's hand while Falma carefully observed Natalie's condition and examined her after she awoke from anesthesia. Falma didn't know much about the procedure here, so getting accurate material on the internet was a big help. They removed all the tumors. They saved my life. Good, thank you. Natalie raised her head and thanked Falma, who was standing next to Françoise. Falma nodded with a slight smile. I raised my head to see other doctors, pharmacists, Emmerich and Josephine on the ward attending to her post-operative care. Natalie learns that the surgery was completed with the cooperation of many people and repeats it again. When Claude heard that Natalie had woken up, Claude appeared in the hospital room wearing a white coat over his surgical gown, probably because he had been summoned by a resident. Hey, I'm glad you woke up, he said. Me too, thanks to everyone. Natalie looked everyone in the eye and lowered her head, crying. I think it was a difficult surgery, and I half gave up because I thought I would never wake up. You should get some rest. Tell me if you're in pain. If you have any concerns, please let me know. I'll be by your side today, so the responsibility for pain management is on me and your mom. Falma winked at Natalie, who was at a loss for words. Professor de Medicis. What? The crocus by the window looks a little prettier, so I have a feeling I can live tomorrow. Natalie finally said this in a hoarse voice. That's good. When spring comes, I'll give you an upside-down blue rose. This time, making the impossible possible? I hate that kind of snobbery from the professor. That sounds like a compliment. She smiled when she saw the playful Falma, fell asleep, and soon began to breathe peacefully in her sleep.